Our topic this morning is Stroke Awareness Month, and we're going to talk about stroke and neurointervention with Dr. I hope I get this all right, and Doctor, forgive me if I mess it up. Dr. Vibhav Bansal. Did I get that right?
Yes, sir.
How are you this morning?
Good. How are you doing?
We're not too bad. Tell us a little bit about you.
So I'm the neurointerventional director and medical stroke director here at Mercy Health. I've been here for close to 3 years. Live here in Rockford during this time. What else would you guys like to know?
Well, I personally, one of the metrics I determine whether or not I like you or not is where you did undergrad, where you started your schooling. Where are you coming from?
Creighton University in Omaha, Nebraska.
The Blue Jays. The Blue Jays, yes.
You okay with that?
Creighton's. I have a cousin that goes to Creighton University. Got her doctorate from there. It's fine.
Oh, nice. Very cool.
Fine university out there. Congratulations. Yeah, you passed muster. We're okay with that.
All right, perfect.
Yeah. See, that's just Joe. You know, for me, a guy who stumbled off the parking lot at a community college, I've got really no stake in this at all. I'm just happy you achieved higher education.
So after you got out of Omaha, where did you do your medical training?
I did my medical training at Cincinnati, University of Cincinnati, and then I did my residency in Chicago, and then at Michigan State.
Wow, that's a fine collection. You got Bearcats, you got Flames, and you got what was the last one?
The Spartans.
The Spartans, yes, Michigan State. That's pretty good. I'm passing with flying colors.
Okay,
so
you're giving him a big thumbs up thus far. All right. What got you interested in the field of medicine?
You know, people in my family have been in medicine, and so it was kind of an easier route anyways. But then once I got into it, I realized I loved it, and I don't think I would be happy doing anything else.
That's a mark of picking a good career.
And then how'd you get steered into, talking about the heart and stroke prevention?
So for stroke prevention, the brain's always been something that's interested me. It's very complex. I don't think anybody to this day fully understands it in its entirety. And so that's just kind of that mystery and that enigma was always very, very appealing to me.
And now in May, I'm guessing, is Stroke Awareness Month across the. We're not doing this pre and having it be June, but May is Stroke Awareness Month.
Yes, stroke is National Stroke Awareness Month.
For people who are unfamiliar, we've had it touch our family. I'm very familiar with how it goes and some of the things that can happen. Describe for people who don't know, what is exactly a stroke? We hear the term all the time.
Sure. So the easiest way to understand what a stroke is to think of a stroke as a heart attack of the brain. In other words, this is when a blood clot lodges into one of the arteries that gives oxygen and blood supply to the brain. And because that artery has lodged, because that clot has been lodged into that artery, there's not blood flow getting through that area. So the brain is not getting the proper food, nutrition, and oxygen. That part of the brain is. So whatever part that brain supplies, so for instance, if that part of the brain supplies your right side of your body, that side will become weak. And if we're not able to treat that part, if we're not able to get that clot out of the brain rapidly enough, that damage will be permanent.
Whenever I hear people start talking about blood clots and brain, the word aneurysm always comes to mind. Is that the same thing as a stroke? Are they related? Does one come with the other? What's aneurysm versus stroke? What are we talking about?
Sure, no, that's a great question. An aneurysm would be considered a ruptured aneurysm would be considered a type of stroke. So in a ruptured aneurysm, the aneurysm is actually a focal weakening of an artery. So basically, the artery normally is very straight, but as the wall of the artery weakens, it starts to balloon out. And over time, that weakened ballooning part of the artery can rupture, just like when you blow up a balloon. As the balloon blows up, gets bigger and bigger, the wall of the balloon gets thinner. Same thing as that aneurysm gets bigger and bigger, the wall of that outpouching or that ballooning gets thinner, and it will rupture, and it can cause major bleeding in the brain. And if you have a ruptured aneurysm, close to 40% of people who suffer from that will actually pass away.
So an aneurysm is a noun, right? Is it the actual blockage? And the stroke is...
It's an actual rupture. It's an actual... No, I'm sorry. It's an actual arterial abnormality. And our fear is that it will rupture. So it's a weakening of an artery, and the fear is that it will rupture.
Speaking of fears and aneurysm, I mean, I don't know if it's an old wives' tale or whatnot, but one of the things you always heard about aneurysms happen to anybody, anytime, any age, any health condition. Is that how scared should I be that at any moment I could get an aneurysm?
Sure. So, I think they've done autopsy studies, and the autopsy studies have shown that like 5% of the general population will have a brain aneurysm. So it's not something to be too terribly concerned about unless you have symptoms where you have a brain aneurysm and you suffer this sudden, severe, worst headache of your life. Or if you don't normally have headaches and you suddenly suffer this sudden, very, very severe, terrible headache. In those kinds of cases, you want to get checked out immediately.
The most famous person I can think of that passed from a brain aneurysm would have been FDR. President Roosevelt, in April of 45, complained of having the worst headache he'd ever had in his life, went to lay down for a minute, and that was the end of that.
That was the end of that, yes. You're right.
You say you check it out immediately. How much time does somebody usually have if they feel that horrible headache? We talking about hours, minutes?
So for brain aneurysm, it can be minutes. So that's what you guys were just saying with FDR. He ruptured his brain. He had a ruptured brain aneurysm, and he passed away immediately. So you want to come to the hospital immediately if you have that symptom. If you have the sudden worst headache of your life ever.
Let's go back to our topic of strokes. Let's talk about the warning signs of that coming on. How does someone know that, or you're observing a family member? How do you know that that's what's going on here?
Sure. So stroke is a lot easier to kind of recognize and diagnose for even family members and whatnot. So we always try to say, remember this acronym called Be Fast. So Be Fast, BEFAST. So if you think your family member is having a stroke, you need to be fast and act fast. The B stands for balance. So any new changes in balance or imbalance. The E stands for eyes. Any vision changes, blurry vision or double vision, that's new. F, face, any facial asymmetry or facial droop. The easiest way you can identify that is just have the person smile and just see if the smile is asymmetric. One side of the face isn't moving as much as the other side. Arms, arm drift. Have the person lift up both of their arms and see if one falls down falls down faster than the other. S is speech. Have the person say a simple statement, like no ifs, ands, or buts about it. And see if they have problems getting those words out or if they have any slurred speech. And the T just reemphasizes the point that time is critical. You need to come to the hospital immediately if you have any of those symptoms.
Yeah, don't wait around. Act quickly.
Don't wait around.
And if you're not sure, definitely go to the hospital.
Correct. We talked about brain aneurysms rupturing. Those are painful. The person has a sudden severe headache. The thing with stroke is that, like an ischemic stroke related to a blood clot, is that it's not painful. You just have a loss of function, right? So your right side won't move, but you don't have any pain. So oftentimes people think, it's not a big deal. I'm not having any pain. I'm not having any headache. But in fact, that's actually a classic sign that you are having an ischemic stroke. And so you need to come to the hospital immediately. And time is of the essence because treatments are very time dependent.
What's the reasoning behind pain for one of the conditions and no pain for the other?
Sure. So when a brain aneurysm ruptures, it ruptures into what we call the meninges. The meninges actually have sensory receptors. So it can feel pain. It can feel sensation. But when a stroke happens, it actually affects the brain itself, which doesn't have any sensory receptors. That's why, you've maybe seen on TV where people will actually have brain surgery and they're awake during the procedure and they're not feeling pain. Because when we're operating on the brain, when we're touching the brain, it doesn't have any sensation or sensory receptors that would cause pain. But the surrounding of the brain, where blood piles or pools to, does actually have pain receptors.
For people who are, obviously engaged in your descriptions of how all of this goes, who's at risk for this?
Sure. So patients at risk are patients with the classic risk factors that we talk about oftentimes, like diabetes, high blood pressure, high cholesterol, obesity, and smoking.
It sounds like too. This is mainly a vascular issue. So is just preventing this in everybody? Is this just overall just general good vascular health, like what you do to take care of your heart?
Exactly. It's the same things to take care of the heart as it is to take care of the brain.
And at Mercy Health, doctor, I've got a problem. I'm going to have it looked at. What do you at Mercy Health offer stroke patients that you're not going to see elsewhere?
Sure. So we are considered a comprehensive stroke center as designated by, state and national organizations. We offer everything 24/7. And then that means that if you're having a stroke and you've come within 4.5 hours of your last known normal, your symptom onset, that you will get the clot busting medication. If you come within 24 hours of your symptoms, you may be amenable to a treatment that we offer where we actually go through an artery in the leg, And we take a small tube or pipe all the way up to the brain where we can actually remove the blood clot itself.
This sort of treatment and technology that you're using, we often do this with the doctors we talk to. Contrast this with what someone would have gone through 30 years ago to what you can do now.
No, that's a great question. So 30 years ago, none of this was available. It's weird to think, we're in the 21st century. How are we coming up with these new treatments? We oftentimes think that everything, great has already been discovered. But this thrombectomy, this procedure where we go through the leg to get all the way up to the brain, only became standard of care 5 years ago. It has absolutely revolutionized the treatment of stroke and the outcome of patients. You've taken a disease process where if you're having a large stroke, your mortality or death rate was at 90%. Okay? Only 10% of people actually survived with a normal outcome. And that number has now risen to about 60 or 70%. Just a humongous, profound change in these patient outcomes. In fact, when these trials were going on, the FDA came in and stopped them. They halted them. They said, we have to stop. It's unethical to actually not provide this therapy to patients. So we have to stop and we have to start providing it absolutely at this moment. So they even stopped the trials early because the results were so good.
That's amazing. You do not hear stories like that very often.
No, not at all.
So I mean, we've grown by leaps and bounds the last 5 years. Where is this field going? What will be different in 5 years?
Sure. So I think, as you touched on the brain aneurysm question, I think that's where we're going to have an even bigger change. Previously brain aneurysms were always treated with open surgery, where they would put a clip on the aneurysm itself. That is now, because with this new field of interventional neurology, endovascular neurology, this field has just grown exponentially. And now you've taken where aneurysms were previously exclusively clipped with open surgery, they are now almost exclusively coiled with the same type of endovascular treatment that we use to treat stroke. So I think we're going to see continued leaps and bounds of improvement and progress in that. And I think what's going to happen over time is that more and more hospitals are going to offer even this thrombectomy treatment for acute stroke that we mentioned.
We talked about treating aneurysms and reacting to them. Are we getting to the point where we can predict them? You mentioned, it's like the balloon, the weakening of the wall. Is there, in my dumb brain, there's a way for us to look in there and see if maybe some of the blood, the vascular system is weak? Can we do that yet?
Yeah, we absolutely can. We can do that with scans such as CAT scans that are designated to look at arteries and MRIs that are similarly designated to look at arteries. They're called CTA and MRA. And if there's any concern by yourself or by a doctor, then those tests can be done. And they're very, very beneficial in screening patients who may be at risk for having a brain aneurysm.
Dr. Bansal, for people who, like I said, who have been tuned into this and are learning a whole bunch of new things just like we are, they've got more questions. They want to know more. How do they reach out to you or to any of the experts at Mercy Health to get those answers?
So you can always call us. We have a phone number, 815-971-5000 at Mercy Health, where you can call us and get a hold of us anytime. By being a comprehensive stroke center, we offer this treatments 24/7. We have an active acute stroke team that's at the hospital 24/7 for any of these patients. Any questions, concerns, or any patient treatment that are necessary.
That's some good news to hear. Doctor, thanks for taking time out of what we know is a very, very busy day, and we appreciate you giving us the education this morning.
My pleasure. Thank you very much for having me.
You got it. That's Dr. Bansal. He's with Mercy Health and Stroke and Neuro Intervention. It is Stroke Awareness Month.